So I'd like to introduce our speaker, Lena Jogi, graduated with a master's in clinical psychology from the University of the West Indies. She specializes in psychoeducational assessment, working mainly with children and young persons, focusing on education and mental health. So Lena is from Trinidad and Tobago, like myself, and is currently based in the UK. So over the last 10 years, Lena has worked in public and private sectors, advocating for the field of psychology in Trinidad and Tobago. And she has held executive positions in the Trinidad and Tobago Association of Psychologists and is a member of the British Psychological Society, as well as the American Psychological Association. And she's actively involved in promoting awareness for mental health and learning difficulties. So this is a very timely presentation, I think, with what's happening worldwide with the pandemic and with digital transformation taking place all over the world. I think this is a very timely presentation. So with that, I'd like to welcome Lena. Like I said, this is the third event for this year, and we're happy that you're a part of it. And thank you for agreeing to speak today. So I'm going to hand it over to Lena. In fact, I'm going to make you the host so you wouldn't have any issues with presenting, and you can take it away.
Okay.
If I didn't mention, please, everyone other than the speaker, could you please mute your mic at this time? Thank you.
Okay, hi, good morning or good afternoon or good night, depending on where everyone is, so good day. Thank you, Ashish and Andrew, for that introduction. Thank you, BCS, for the opportunity. And we're going to get started. So I'm hoping that everyone can see the screen now. Okay, great. All right, so I'm just making sure everything is in order here. So the topic is the impact on mental health due to increased use of technology during COVID. And in this case, it's about increased use of technology, meaning digital devices, digital transformation, basically screen time and being online, and COVID meaning the pandemic. So let's look at what we will cover. How COVID affected mental health worldwide, impacts of COVID-19 and digital transformation or technology, the impact on mental health due to increased use of technology during COVID, and how we can minimize the negative impacts. Okay, let's go on. So let's take a look at this. So how COVID affected our mental health. So along with the obvious physical implications for people who contracted COVID-19, the pandemic had a devastating mental health impact on people all over the world. So you can see that we would have been affected by grief, who have lost loved ones, and unease at losing job and economic security, frustration of lockdowns. Some of us had to deal with many, some had to deal with constant lockdowns for a very long period. It was very variable throughout. Challenges of working from home while taking care of the children, and always having that fear of contracting the disease have all taken the toll on mental health. So before we go into the actual that toll, I wanted to look at the impacts of COVID-19 in digital transformation. So a study done in August 2021 was designed to research whether COVID-19 is a driver of digital transformation, which is DT, and to look at the three most positive and negative DT disruptors. So digital transformation has been defined in many ways, but generally it is the use of information and communication technologies, ICT, along with their benefits to change business operating models, products, services, and organizational structures to obtain a competitive advantage. So the study suggests that COVID-19 has been a driver of digital transformation. where 94% of the respondents agreed that COVID-19 has been a driver of digital transformation. Secondly, technology, automation, and collaboration, TAC, in the study, is the most positive significant factor which enables work from anywhere, WFA, or work from home arrangements, and also leads to the third positive factor of a work-life balance. So working from anywhere removes the geographic barriers and offers dependency. The geographic barrier may help to improve employment in developing countries, and digital transformation is enabling WFA as it depends on technology, as it removes brick and mortar kind of work culture, which is one way you're seeing right now. We're in different countries, and I'm able to provide a webinar whilst everyone is in different parts of the world. So I just wanted to define here TAC, as it was saying here, technology, automation, collaboration. It would involve also video conference, virtual meetings, teleconversation, telecommuting, IT security, virtual workplace, mobility, globalized skill sharing, business process improvements. And working from anywhere would mean more productivity, remote working, flexibility in work, pollution-free as well, time saving as no commuting is needed, ability to multitask, no global barrier, and that flexible work environment. And work-life balance would mean spending time with family or children, having to review the general work culture, finding that balanced type of lifestyle, staying together and connecting with friends. So now let's look at the negative impacts, right? So just give me a second. Right. So what we found here in this study is no work-life balance. So that's interesting that it was positive, and also it's also a negative, no work-life balance. So work-life balance versus no work-life balance, which meant no defined working hours, long hours. So there was a blurriness with the hours of work, lack of physical social interaction, too many distractions, overwork, back-to-back virtual meetings, perhaps some might be on schedule, loss of job insecurity, and stress. Then another negative issue was social employment issues, low income, more home expenses, buying unwanted things, no social life, technology reliance, sometimes slowness or network issues, and data security and technology issues, data privacy, cybersecurity, additional technology skill set needed, misuse of technology by family members, lack of technology robustness, cybercrime, online fraud, those sort of things would have been the negative aspects of these impacts of COVID-19 on digital transformation. So the negative factors show a contradictory results, since no work-life balance is the most negative factor, even though work-life balance is a positive factor. And I think one of the reasons here is something that we have to learn to work towards improving, because I think these things came out of COVID, and it was a matter of trying to readjust, having to deal with that new normal. And as we leave, or now getting to another type of new normality, because now we're trying to coexist with COVID, but also go back into what we knew. But there have been some changes, so there are constantly that adjustment having to take place. Okay, so let's take a look at the information on increased use of technology. According to a 2019 survey, 28% of American adults said that they were almost constantly online, up from 21% in 2015. About 3 in 10 American adults say they are almost constantly online. And about half of young adults ages 18 to 29 said they go online almost constantly, and this has been a 9 percentage points higher than it was in 2018. And again, another type of study was done here is based on a survey of 16 to 24-year-olds in 2020. Screen time has increased by 76% during the COVID-19 pandemic. And in 2019-2020, computer and mobile screen usage drastically increased on a global scale. A staggering 76% of the population between 16 and 24 are spending more time on their phones, while 45% have increased the amount of time they spend on their laptops. And it's not just phones and laptops. 34% of the population are spending more time watching TV, while 22% have increased their tablet usage. Okay. So the impact on mental health due to increased use of technology during COVID, this is where we're now getting into the crux of the matter. So as we noted, the results reveal that screen time increased drastically during COVID-19. And why? So during digital technology provided avenues to connect. So we needed it for work, for school, and for socializing, connection. So using a screen to keep connected to people have built a relationship with as a bridge is a more positive use of screens than just scrolling through Instagram or things that don't enhance your relationships. So in other words, it can be beneficial to use Facebook to catch up with a friend from across the world, as long as it's not interfere with making in-person plans with other people. So a 2019 study stated researchers found that adults who use social media were less likely to experience psychosocial distress. So that is related to depression and anxiety. However, overindulgence or overuse of digital devices can be harmful in the long term. Looking at screens for several hours per day can worsen a person's mood. And again, researchers found that adults who watch TV or use a computer for more than 6 hours per day were more likely to experience moderate to severe depression. So research has delineated negative impacts of increased screen time on physical and mental health. Problematic screen time is characterized by obsessive, excessive, compulsive, impulsive, and hasty use of digital devices. Though there are mixed consequences of prolonged screen time use and blurred understanding between healthy and unhealthy social connectedness over digital media, the suggestions for negative implications on physical and mental health warrant a strict need for inculcating healthy digital habits, especially knowing that digital technology is here to stay and grow with time. So now we're looking at some impacts on physical and mental health. A large number of original studies indicate excessive screen time has adverse health effects in long run, such as physical health symptoms like eye strain, sleep disturbance, carpal tunnel syndrome, neck pain, as well as mental health problems ranging from difficulties in concentration to diagnosable mental illnesses such as anxiety, depression, and even attention deficit hyperactivity disorder. For adults, the World Health Organization highlighted that increased screen time replaces healthy behaviors and habits like physical activity and sleep routine and leads to potentially harmful effects such as reduced sleep or day-night reversal, headaches, neck pain, myopia, and cardiovascular risk factors such as obesity, high blood pressure, and insulin resistance due to increase in sedentary time among adults. Evidently, increased screen time has alarmingly caused collateral damage to optical health, eating habits, and sleep routine, and studies have found association between excess screen time and poor mental health among adults. So these are quotes that I'm reading from studies done. So though digital devices kept many socially and emotionally connected, screen time also resulted in experiences of irritability, corona anxiety, sleep problems, emotional exhaustion, isolation, social media fatigue, and screen fatigue, and phantom vibration syndrome. So for those who don't know what phantom vibration syndrome is, or phantom ringing syndrome, it is a perception that one's mobile phone is vibrating or ringing when it is not. So the constant connectivity may actually be making us feel disconnected, and screens are taking us away. Screens are taking us away from the real relationship in our lives.
Sorry, Lena.
Mm-hmm.
Excuse me, can everyone please mute their mic except for the speaker, please? Thank you.
Okay, no problems. I'll repeat. So as I was saying, the constant connectivity may actually be making us feel disconnected, and screens are taking us away from the real relationship in our lives. So sometimes we do get carried away and end up focusing on all that screen time. So spending extensive hours in front of the computer and smartphone affects your personal life, family, children, and any relationship. Screen time is also a sedentary behavior, and high sedentary levels are linked to mental health problems such as anxiety, depression, as well as the physical aspect of high sedentary levels. All right. So here I'm going to look at the impact of increased screen time on young persons' health, so young person and children and young persons. As of the 25th of April 2020, around 1.5 billion children have been out of school, and as a result, many of them may be spending more time, well, they were, because hopefully many of these children have been going back to school and the schools have reopened. But many of them may be were spending more time on screens to complete online activities as part of homeschooling, socializing with peers, or playing video games, given that outdoor activities were restricted due to the lockdowns. Children and youth showed lowered physical activity levels, less outdoor time, higher sedentary behavior that included leisure screen time and more sleep during the coronavirus outbreak. The two crucial negative impacts of screen time on the physical health of children and adolescents were sleep problems and physically increased risk of myopia. And I will touch on that a little bit later, specifically the sleep problems. So though digital devices kept many socially and emotionally connected, screen time also resulted in experiences of irritability, again, corona anxiety, sleep problems, emotional exhaustion, isolation, social media fatigue, and as mentioned before, phantom vibration syndrome. Sudden increase in complaints of irritability without internet connectivity and smartphone, gambling, inability to concentrate, absenteeism in online educational classes or work due to disturbed sleep cycle and unavoidable excessive use of smartphones have been reported in the media. The mental health impacts of excessive digital use include attention deficit symptoms, impaired emotional and social intelligence, social isolation, and diagnosable mental illnesses such as depression, anxiety, technology addiction like gaming disorder. So in a study with older adolescents aged between 18 and 20, researchers found that smartphone dependency can predict higher reports of depressive symptoms and loneliness. Young people have been particularly vulnerable to the harms associated with excessive screen time or gaming, including unhealthy sedentary lifestyles, exposure to harmful contents, misinformation about COVID-19, cyberbullying, development of gaming disorder, or engagement in online gambling. All right. So this is a nice picture here that looks at the negative effects your devices are having on your health, such as mentioned before, whether it's just sort of summarized: decreased concentration, focus, motivation, retina overstimulation. So screens can have a big impact on transient blurry vision, and it can increase the need for wearing glasses, the discomfort of the eyes, and performance at work. It can also have a detrimental effect on our neck and shoulders. So that's one of the issues as well. Decreased intimacy in couples, fatigue, insomnia, delayed sleep, vision changes, headaches, loneliness, isolation, touch deprivation, lack of motivation and creativity, stress and techno-stress. And it's mentioned here what techno-stress is: irritability, insomnia. Right. So we're sort of halfway there. So now we're gonna look into more of how we can minimize the negative impact. And I'm hoping that we're okay for time. Just want to make sure that we're okay for time.
You're good, Lena.
Okay, cool. Right. So I think you guys might be expecting that talk about Zoom fatigue. And I found this peer-reviewed, well, the Zoom fatigue, it is an article done by Jeremy Bailenson. It was, so in the first peer-reviewed article that systematically deconstructs Zoom fatigue from a psychological perspective, published in the journal Technology, Mind and Behavior in February 2021, Jeremy Bailenson has taken the medium apart and assessed Zoom on its individual technical aspects. He has identified 4 consequences of prolonged video chats that he says contribute to the feeling commonly known as Zoom fatigue. Right. So the first one is excessive amounts of close-up. Eye contact is highly intense. Both the amount of eye contact we engage in on video chats, as well as the size of faces on screens, is unnatural. So in a normal meeting, people will variously be looking at the speaker, taking notes, or looking elsewhere. But on Zoom calls like this one, everyone is looking at everyone all the time. Perhaps sometimes that's also a good reason that, when you're doing a Zoom call or a meeting, it's good to not always have the videos up, because then a lot of people just be looking around. A listener is treated non-verbally like a speaker. So even if you don't speak once in a meeting, you are still looking at faces staring at you. And this can be anxiety and stress provoking. Another source of stress is that depending on your monitor size and whether you're using an external monitor, faces on video conferencing calls can appear too large for comfort. In a way, personal space is invaded. So the solution: take Zoom out of the full screen option and reducing the size of the Zoom window relative to the monitor to minimize face size, and to use an external keyboard to allow an increase in the personal space bubble between oneself and the grid. Right? That's one. Next one is seeing yourself during video chats constantly in real time is fatiguing. Most video platforms show a square of what you look like on camera during a chat, but that's unnatural. It's as if somebody was following you around with a mirror constantly. Bailenson cited studies showing that when you see a reflection of yourself, you are more critical of yourself. Many of us are now seeing ourselves on video chats for many hours every day. It's taxing on us, it's stressful, and there's a lot of research showing that there are negative emotional consequences to seeing yourself in a mirror, especially if you're criticizing yourself. So the solution here is use the Hide Self View button, which one can access by right-clicking their own photo once they see their face is framed properly in the video. I am not sure if I've ever done that before. Okay. Now let's try looking at the next one. So 3, video chats dramatically reduce our usual mobility. So in person and audio phone conversations, especially audio phone conversations, allow humans to walk around and move, But with video conferencing, most cameras have a set field of view, meaning a person has to generally stay in the same spot. Movement is limited in ways that are not natural. And especially if someone moves around a lot, they will distract you. There's a growing research now that says that when people are moving, they're performing better cognitively, technically, especially for persons who need to move around to stay alert. Staying in one position is very difficult. So the solution here is, if possible, Bailison recommends people think more about the room they're video conferencing in, where the camera is positioned, and whether things like an external keyboard can help create distance or flexibility. For example, an external camera farther away from the screen will allow you to pace and doodle in virtual meetings, just like we do in real ones. And of course, turning one's video off periodically during meetings is a good ground rule to set for groups, just to give oneself a brief non-verbal rest. Okay, next one is number 4. So Bailison notes that regular face-to-face interaction, nonverbal communication is quite natural, and each of us naturally makes and interprets gestures and nonverbal cues subconsciously. But in video chats, we have to work harder to send and receive signals. So humans have taken one of the most natural things in the world, an in-person conversation, and transformed it into something that involves a lot of thought. You've got to make sure that your head is framed within the center of the video. If you want to show someone that you are agreeing with them, you have to do an exaggerated nod or put your thumbs up. That adds cognitive load as you're using mental calories in order to communicate. So the solution here is, during long stretches of meetings, give yourself an audio only break. This is not simply you turning off your camera to take a break from having to be non-verbally active, but also turning your body away from the screen, so that for a few minutes you are not smothered with gestures that are perceptually realistic but socially meaningless. Okay. All right, so now, whilst I was looking at just at Zoom fatigue with also the difficulties and the solutions, now I'm actually just going to talk more about how we can manage our screen time, because as mentioned before, we know that there have been a lot of detrimental effects on spending too much time, or basically just abusing what we do online, like being on the phone, scrolling. Sometimes in work, we have to be online. So we're going to look at how we can manage screen time at work. Right. So despite the potential adverse effects of screen time on health, it is impossible to abstain from screen time in modern times, as many adults use computers for work 8 or more hours per day, 5 days a week. Oftentimes, the most successful tactics to minimize technology harm are not technical at all, but behavioral, such as self-imposed limitations on use of digital platforms, using non-digital means when possible, and using digital platforms for better health and well-being. Users should regularly stretch, blink, and change positions. Active breaks are encouraged to avoid prolonged work, which is usually an hour or more, involving static postures. And I think in all workplace, you are advised to get a display screen, equipment, risk assessment. So this is just an example of some of the things that might have been pulled from a display screen, equipment, risk assessment. And this is a picture here, and there are many online on some exercises that you can do, the desk stretches and so on. It's important that you take short breaks, get up, walk around. You can break up your screen work with other activities, whether you need to be on the telephone, fax, file, photocopy, scan, or make some tea or coffee. And also, if you were to take lunch, avoid taking lunch in front of a screen or being at your desk, especially. Making sure that you take stretches, legs, arms, and back. Sometimes you may need to just do that on a chair. Even eye breaks and exercises. So sometimes you might not even realize that you're spending a lot of time just looking at the screen for a long period and just turning your head on, blinking, and just also changing that position so you're not really stuck in that situation for too long. And also there are tools now that you can use to track screen time, or you can use a timer when you can tell yourself to take a break. Now I'm going to look at how you can manage screen time at home. Have an active time in front of the screen where one can stretch or do exercises while sitting or standing to cut the stagnancy of long screen time. So for some people, and this is at home, just walk home could be a blur as well. So I'm talking about not working at home, but actually being home. And if you are on a screen, some people might be on a treadmill and might look at a show, and at least they're moving while looking at a show. Or if they have to be at home and they're on, doing something on a screen, perhaps you could make sure to move. And of course, one positive of a screen is actually using videos to help with physical activity. Also, ensure free time of digital devices as a family, and such as indoor games, board games, and not allowing the screen during meal times. So ensuring free time of digital devices as a family can not only reinforce staying away from digital technology, but can also build healthier spaces for family members to interact. Set rules. Again, this is also where you can have a place or time where there's no screens or no screens allowed, and especially not having to utilize a screen when having a meal might be a good rule to implement. And very important is adults model good habits. There's a need for responsible adults to model digital well-being so that it can be inculcated as a habit. Observational learning is impactful. So that is basically leading by example. So other ways of managing screen time, other things to note. Resort to audio calls to beat screen fatigue as a result of multiple video calls. So sometimes you may not need to have a video call. It's better to be on audio only. Try using the voice note option on various social media platforms to reduce the screen stare while typing a message. Actively giving up phone phobbing, the act of snubbing someone you're talking with in person in favor of your phone and connect with people around. I am guilty of that. And so that's something that we all have to, I'm sure at one point or the other, we have done that. So we have to remember to be mindful that in a setting, a social setting with actual people, to not be spending time on the phone. Proactively be in touch with friends and relatives, checking on people about their days, and ditching the digital devices once in a while can make a good break and enhance social connectedness. Use of mobile applications for promoting digital well-being. Mobile health apps are becoming increasingly popular to stay socially connected, as well as aiding mental well-being. So you have apps for that, but also for on your phone itself, there are a lot of options that you can find out on your phone settings where you can pause distracting apps to stay focused, certain daily limits, having site timers, customizing notifications, allowing for do not disturb moments, a bedtime mode, grayscaling your screen so that it doesn't become distracted by the icons. And just also you can track your time that you spend online. So those are things that you can find on your phone alone. And then you have these apps as well that you can access that can help you with all of those as well. So again, here is a nice summary of some things were mentioned, probably some things not mentioned in a photo. So here it says set a screen time maximum per day, 4 to 6 max where possible with work schedule. So screen time boundaries, allowing that maximum screen time. Doing screen-free activities that was mentioned. Having to reconnect in real life. Reduce screen brightness. Now there is mention of the blue light protective glasses while using screens. Again, I'll come back to that when it comes to sleep. But if there have been some research about spending too much time on a screen can have problems on your eyes because of the blue light. So the blue light protective glasses help with minimizing the light that entering your eye. These lenses filter blue light rays to help prevent them from entering your eye and causing potential damage. Blue light has a short wavelength, which makes it very easy for it to penetrate the eyes. This means that almost all visible blue light rays can pass through the cornea and lens to the retina. While there's little research to support this, some experts have suggested that too much exposure to blue light has the potential to damage the light-sensitive cells in the retina. Usually blue light lenses have a slightly yellow tint to counterbalance the blue light, but you can't usually notice this, right? Another one I was mentioned that you can find on your settings is removing notifications. A good one, and as easy as it may sound, is thinking twice about using your phone. So you are possibly always going to reach for your phone, but why are you reaching for your phone? A lot of times we want to have that as an extra appendage, but think about whether you really should actually be, what's the purpose? Is it an important email that's coming in, or is it because you're looking into social media or boredom and you're really, it's just a habit? So ask, do I need to look at my phone now? As mentioned, set screen time limits, use a dark or gray mode to limit blue lights. And the last one is seek professional help if you feel it is a serious problem impacting on your mental and physical health. Okay. All right, so almost there. I wanted to focus a lot on screens at bedtime. So sleep deprivation is related to mental health conditions, including anxiety and depression. One study from 2014 shows that the use of screens before going to bed can disrupt sleep cycles, in part by suppressing melatonin. So what's happening is that the smartphones have blue light that is emitting from the screen, which is tricky and damaging if you do that at nighttime. What's happening is that it tricks your brain into thinking it's still daytime. And so it reduces your feeling of sleepiness or drowsy, and it prevents the melatonin, which is what increases one's feeling sleepy, and then you take longer to fall asleep. So instead of choosing a screen before bed, read a book or magazine rather than something on a phone or tablet before going to sleep. So I wanted to talk a little bit more on sleep hygiene. So sleep hygiene refers to sleep practices, habits, and environmental factors that are necessary for getting quality restorative sleep. Very few of us get education on effective sleep practices, and many of us take sleep for granted. In fact, we almost always choose something else over sleep, some of us. So here are some things that we can do for our sleep hygiene. These are some tips. Wind down, try decaf tea, a warm bath, a light snack, sometime reading, listening to music. Avoid the screens before going to bed. Choose a book to read. Also, try getting up at the same time every morning, which helps with a routine, which is something that was completely damaged during COVID. And that's something that we have to get back into. Have a regular schedule, regular times for meals, medications, chores, other activities, help keep the inner body clock running smoothly. Avoid caffeine after lunch or late in the day. Now, be aware that maybe caffeine is something that you might need after lunch, but also it could be a possibility of preventing you from actually having a good night's rest. Do not go to bed hungry, but don't eat a big meal near bedtime either. Have a light snack. Have your bedroom quiet, dark, and a little bit cool, and use your bed for sleeping only. So if possible, do your chatting, gaming, work, and TV watching elsewhere. Having these type of screens in your bedroom actually prevents that restful nights. And this is the last thing that we'll be focusing on is on excessive gaming. So signs of excessive screen time or gaming, it includes affecting a person's ability to focus and complete tasks, school tasks, negatively impacts a person's relationship with family members and peers. It takes priority in a person's life over the basic functions such as eating, sleeping, personal hygiene, and exercise. It causes significant changes in a person's mood or ability to control outbursts, example, physical aggression, when the person is asked to stop. And it can encourage a migration to gambling, as some games have gambling-like elements. Parents and guardians should be mindful that the boundaries between gaming and gambling are becoming increasingly blurred. Increasingly, online games include gambling-like elements such as loot boxes or microtransactions, and marketing of video games has significantly increased amid the COVID-19 pandemic, some of them with gambling themes. So games with gambling-like elements may have financial implications and increase the risk of migration to gambling. So the World Health Organization advises a sedentary screen time, including playing video games, is not recommended for 1-year-old infants and should be limited to no more than 1 hour per day for children 2 to 4 years old. So it's not recommended for 1-year-old infants and no more than 1 hour per day for 2 to 4 year olds. So here are some tips for helping to manage excessive screen time or gaming. Empower children with information and knowledge about how to use internet safely. Educate them to be vigilant about cyber fraud. Set clear rules and boundaries about screen time and how, when, and where children can use the internet. Create a balance between online and offline activities. Watching television and doing online activities versus cooking together, reading, board games, arts and craft, dancing, and exercising. Install the latest software updates and antivirus programs on devices. Set the privacy settings to high and activate parental control features, especially for younger children. Maintain that regular sleep routine for children and encourage healthy eating. And here, I just wanted to take a look at this: screen time and physical activity. Higher levels of screen time and lower levels of physical activity were associated with lower life satisfaction and higher psychosomatic complaints among adolescents from high-income countries. Public health strategies to promote adolescents' mental health well-being should aim to decrease screen time and increase physical activity simultaneously. So this is a study done that looked at life satisfaction between boys and girls and screen time usage versus life satisfaction and physical activity. And as you can see, it's very different in terms of screen time versus physical activity. So the solution here is to go outside, right? So engage in outdoor activities, walk, run, cycle, birdwatch, go to the beach, engage in sports, football, cricket, or whatever it is that you enjoy doing outdoors. This is a picture of my outdoors. So that's really nice and inviting, and it's so pretty and beautiful on a nice sunny day. So it's very important to ensure whenever possible to try to go outside. So just in conclusion, largely evidence indicates negative effects of prolonged screen time on health, including mental health. Although digital technology provides avenues to connect socially, overindulgence or overuse of digital devices can be harmful in the long term. Adapting strategic measures can help scrutinize digital use and screen time not only amidst COVID-19, but also ahead, considering that digitalization is the way forward. Empowering individuals to make informed based decisions is the need of the hour to mitigate these ill effects. So let's look at COVID-19 positively. A crisis provides an opportunity. The COVID-19 pandemic provided an opportunity for promoting and disseminating technologies, and we are adjusting to a new way of working. And thank you so much for your time and attention. I hope it was informative and helpful. I have some references at the end and some additional information here that you can peruse at your own time.
Thank you. Thank you, Lena. I think this is a fantastic presentation, very informative, lots of information being shared here. I especially liked your visuals with tips and tricks for breaking the monotony of being glued to the screen. I like how you separated work from home and you gave tips for both sides. I really enjoyed that. Thank you. I think we have some time for a few questions. If you just maybe 1 or 2 questions, 10 minutes on to half an hour. One of the questions that came in, the statistics that you showed about screen time, are they both work and home screen times?
Which one? Is there anyone in particular?
There was a particular, there was a statistic on how, I think there was a maximum, the usage, the increased usage of screen time. Is this both for work related?
I think it might have been both. It was specific on work only. I think it was general. So like use of the time on the screen. So it wasn't specifically work. Okay,
thank you. Another question was, I think you might have addressed this in one of the other slides, but is there a way to quantify what is excessive screen time?
So I didn't actually put that in this, but it did in one of the slides that was mentioned that 6 hours or more can be detrimental. However, that's also one source. We do know that we do spend at times, for people who are working, it's 8 hours that you're on the screen, but it's hopeful that you're not on that screen constantly for 8 hours. But if you are utilizing televisions, any screen, TV for more than 6 hours a day, that could probably be an issue. But most of the times when you're looking at, let's see, what can be detrimental is that it affects your other parts of your life, whether it's work, social, personal life. That's when you have to start looking at how screen time could be a detriment to your life.
Thank you, Lena. Actually, I had a question, but I think you've answered it there. You know, as most of us start off as an IT professional, we all start off our career as programmers, and we're in front of the screen programming probably sometimes 10, 12, 15 hours a day, nonstop. When I started off, it was 18 hours a day. You know, so knowing that 6 hours is probably a good chunk of screen time, I can probably break my scrums or my sprints into 6 hour sections. So yeah. Thanks a lot for that. Yeah.
If you do have to spend that many hours, you would need to break it up, find different things to do. Really not try to spend that many hours on the screen, but breaking it up and finding breaks.
Sure. So I think we're at time. So Lena, thank you very much again. It was a pleasure to have you. Great presentation, great information. Of course, this presentation has been recorded. All the material will be shared with all the participants. And yeah, and thank you everyone for attending. I'm just going to hand over to Andrew to close off. Thank you very much, everyone.
Okay. Well, thank you again, Lena. Very, very informative. I like the phantom vibrating phone one because I've been suffering from that. Although I'm pretty sure I've got a couple of apps, well, if I know I have, that vibrate, but then don't put a badge icon on, which is the most frustrating piece of user experience I can imagine. Your phone vibrates, pull it out of your pocket, and there's nothing for you to look at. I think whoever wrote that application, what's the right word for it? Well, deserves a strict telling off. I'll leave it at that. Anyway, thanks everybody for joining. Great turnout. And thanks again to our presenter, and hope to see you at some of our future events, which we'll be advertising in the same way that we did for this one.